Hey, I'm Dr. Alex Tauberg, a primary spine practitioner and evidence-based chiropractor. Today I'm going to go over temporomandibular joint pain, what causes it, and some things that you can do at home to alleviate it. The TMJ is one of the most commonly used joints in the body, as well as being one of the most complicated joints in the body, and for that reason it's commonly injured and commonly we get a lot of pain there. So TMJ pain can come about from a couple different ways. Usually it comes about either because of overuse or trauma. Overuse usually takes the form of repeated chewing or clenching the jaw, and then trauma of course takes the form of either direct trauma right to the jaw or possibly trauma to the head and neck region that could be associated with some muscle spasms in the jaw that throw off the mechanics there. So since TMJ pain is so common and is commonly associated with overuse, one effective thing that you can do is get a night guard. So a night guard is similar to a mouth guard. It goes over your teeth. It's made of plastic, a pliable type of material, and it helps to take some of the tension off of the jaw, especially when you're clenching it. It can also protect the teeth if you're someone who grinds your teeth at night. I commonly recommend these for people with TMJ pain, especially because TMJ pain can be caused by clenching your teeth, as well as clenching your teeth can be a symptom of TMJ pain. So I find it pretty useful for most people with TMJ pain. In addition to using a night guard, I commonly recommend that those suffering from TMJ pain to perform home exercises. Make sure that when you're performing home exercises that you keep in mind that you need to be as gentle as possible. You don't want to overdo it. You don't want to push too far. You don't want to cause too much pain. You don't want to push too far into pain or increase the total amount of pain that you're feeling. You definitely don't want to cause the joint to lock up, things like that. So just being as gentle as possible is really important. In reality, it's probably best to consult with a health practitioner to make sure that exercises and these tips are right for you. But with that said, the three most common exercises that I prescribe are the tongue TMJ exercise, the repetitive protraction exercise, and then the sustained traction and protraction exercise. So first let's go over the tongue TMJ exercise. To perform this, you put the tongue at the roof of your mouth, just behind the back of your teeth, with your teeth touching. You move the tongue into the middle of the soft palate, and then you open the jaw slowly to the point where the tongue is just barely touching the soft palate of the mouth, and you hold this position for approximately 5 seconds. I generally recommend that people perform this 3 sets of 10 repetitions. This exercise is really great for just retraining the jaw muscles, getting it to move appropriately without the clicking or popping and without the pain. So what this looks like is just going like this. And then just holding that. The next exercise that I commonly have people perform is the repetitive protraction exercise. With this exercise, you need to be careful because it can be bad for some people. It's not right for everyone. You'll want to make sure that you're not going into pain with this exercise. Make sure the joint's not locking up. So when this exercise does work, what we'll often see is people have decreased amount of pain both during the exercise and then also after the exercise is complete. So what you do is you relax your jaw into the open position, and then you take your index fingers and you hook them behind the canine teeth on both sides, and you take your thumb and you hook it behind the jaw here, underneath the jaw here, and then you slowly and gently pull the joint outwards and hold it for about a second, and then relax the pressure slowly, and then you perform this in a repetitive motion. Generally I say 3 sets of 10 repetitions. I'll show you what this looks like here. The goal of this exercise is really to just get the joint moving, get it functioning properly. And again, with this exercise, you don't want that huge clicking or popping sensation happening. The final exercise that I will recommend commonly is associated with the last one. It's very similar, really. In this one, you kind of use the same position. You get into that relaxed jaw position again, grabbing the jaw in the same manner. And this time, you just hold it in that protracted and extended position for an extended period of time rather than letting it on and off. You just hold it So I'll show you that, and I generally recommend holding this for like 15 to 30 seconds until you really start to feel it start to relax around here. And what this one does is it more or less just gaps the joint, can help the muscles to relax some. It's a little bit different than the other one, but it's almost the same at the same time. So after I have people perform these exercises, what I commonly recommend is that they'll do a self-massage afterwards. Doing a self-massage, what you want to do is focus on the muscles around the TMJ. This is pretty easily performed using your thumb in a cross-friction type of massage. Just generally going over the muscles right above the jaw and into the jaw, and just making sure that you're focusing on the whole area. It can be pretty tender, so you want to be careful. Afterwards, you don't want it to be increased pain. You just want the area to feel more relaxed. But just going over there and trying to get the muscles to relax some can be really effective, help with TMJ pain. You want to make sure that you do this on both sides usually when you have TMJ pain. Afterwards, again, you want to make sure the area feels relaxed rather than irritated. If it's feeling irritated, you probably don't want to continue doing that. So these are some tips and exercises that I find to be useful for most people with TMJ pain. However, like I said, they might not be right for you. They're not right for everyone. And ideally, you want to be assessed by a trained professional to make sure that you're receiving the right treatment. I want to thank you for watching my video, and I hope you have a nice day.